Hello, everyone. Welcome. My name is Anika Carter, and I am one of the co-founders of Rooted LLC. I'm so excited to be here with you all to discuss perinatal anxiety and BIPOC birthing persons. This topic is near and dear to our hearts as mental health clinicians and birth workers who do the core of our work alongside communities of color. And today, we're going to focus our discussion on defining what perinatal anxiety is, the common risk factors, the effectiveness of universal screening, comprehensive interventions, and treatments that are culturally responsive and accessible. Hello, my name is Kaniya Samm, co-founder of Rooted LLC. And again, I just wanted to thank you all for joining in on today's conversation. As many of you may know, depression and anxiety are common during pregnancy and about 1 year postpartum. When looking at the statistics, perinatal anxiety is experienced at higher rates among BIPOC birthing communities. And what do I mean by BIPOC? BIPOC meaning Black, Indigenous, people of color. And again, as you may know, perinatal mental health influences maternal and infant health outcomes. Therefore, intervening to improve perinatal mental health should be a priority for all healthcare providers. Yes, and so before we begin today, we wanted to take the time to introduce who we are and how we show up in this work. So we are Rooted, a wellness startup on a mission to improve access to care by providing culturally responsive care for all. And today we are one of the leading providers creating a healthcare space where all experiences are empowered and normalized. Wonderful. So as we jump into today's discussion, we feel like it's extremely important to start with the working definition of perinatal anxiety. So as you can see on your screen, perinatal anxiety is defined as distressing thoughts and feelings during pregnancy and about 1 year postpartum. It is important to note this as a working definition because not all birthing persons will experience perinatal anxiety up to 1 year postpartum. Many may experience this up to 2 years postpartum and beyond. The prevalence of perinatal anxiety for birthing persons is actually close to 30%. Yet when we break down this percentage, we find disproportionate rates of prevalence leaning more towards BIPOC birthing persons. Throughout this presentation, we will highlight an intersectional approach to identifying perinatal anxiety, risk factors, diagnoses, and treatment. So now that we have identified what exactly perinatal anxiety is, it is very important to start with the risk factors, which have a large influence on perinatal health. This is also where we see the most disparities between racial and ethnic groups. Most pregnant women naturally experience some reluctance in deciding to access mental health care because they are not sure what is normal or what a normal experience during pregnancy is, or at what point their depression or anxiety should be a concern, right? So we have this internal monologue. However, when it comes to BIPOC birthing communities, it is coupled with socioeconomic barriers such as poverty and decreased access to resources, along with racism, trauma, and cultural barriers, all of which make it more difficult for minority birthing persons in specific to receive mental health care during pregnancy. These socioeconomic barriers can also be considered the structural determinants of health, right? So looking beyond society factors and really looking at policies, racism, and other factors. So when you take an ecological approach, it can really mitigate some risk factors which we've identified and provide clarity for appropriate assessments, referrals, and follow-up care. Now that we've touched on the socioeconomic barriers, it's also important to look at other risk factors related to perinatal anxiety. Ones that focus on the physical distress of the body, especially during pregnancy, labor, and postpartum healing. Some of those things are pelvic floor dysfunction, and that is typically when the pelvic floor is weak. Birthing persons experience incontinence, pain during sex, and just overall discomfort, which can really increase the stress levels within the body. We also want to look at chronic hypertension. So this is essentially chronic stress that is experienced over a long period of time and really act as a risk factor for increasing perinatal anxiety, depression, and on the worst outcomes, maternal mortality. Within the literature, as well as in people's real life experience, perinatal anxiety has been a strong predictor of postpartum depression. Perinatal anxiety has been related to poor maternal health outcomes in the early postpartum period. Pregnant women or birthing persons who are depressed are actually more likely to be exhausted and experience migraines, and back to that incontinence, which we talked about before with the pelvic floor dysfunction, as well as low breastfeeding. Prolonged perinatal anxiety can also result in maternal mortality. For example, Black birthing persons are 3 to 4 times more likely to experience maternal mortality. Cardiovascular conditions is also one of the leading causes of maternal mortality. And you can see how these deaths are closely related to stress and an increase in high blood pressure. Untreated perinatal depression and anxiety are significant public health problems that disproportionately affect BIPOC birthing communities. And despite the widespread efforts to increase screening for perinatal depression and the availability of effective interventions, the majority of women who experience these serious psychological distressors do not receive mental health services during this perinatal period, right? So it's really important that we focus the need on all women and BIPOC women to get the mental health services that they need to address the mood disorders that they may face. Untreated perinatal depression and anxiety are significant public health problems that significantly impact BIPOC birthing communities. And despite the widespread efforts to increase the screening for perinatal depression and the availability of effective interventions, the majority of women who experience these serious psychological distressors during this perinatal period receive little to no mental health treatment. Screening and assessment are the actionable and measured means of prevention for detecting perinatal and postpartum mood and anxiety disorder, also known as PMAD. And the early detection of these mood disorders can not only provide early interventions to the birthing person, but it can also decrease the anxious mood by providing the clients that we work with language and reason to changes in their mood. So it is best practice that when screening for perinatal mood disorder, it should be done on all birthing folks, be it they are pregnant or in their postpartum period, and regardless if they have a history of depression and or anxiety. And so screening and assessments can be done by anyone with clinical access to the patient with the proper training and should be followed up with their OB-GYN. And so also, the patient's doctor can follow up with questions during each follow-up appointment for the continuity of care and to assess underreporting or conflicting reporting of one's mental health status, as we know that stigma and lack of knowledge can also be contributing factors to underdiagnosing and underreporting of mental health status. And so when we think about what are some of the reasons for the limitations in screening and assessments, providers most often cite insignificant time, resources of training, and inadequate reimbursement as barriers to providing screening. But it is imperative that as providers, we provide appropriately timed perinatal depression and anxiety screening, as well as education to not only the birthing person, but their family members and other supportive persons in their life. Because it is no longer acceptable for us to stand by and to allow these preventable health outcomes to persist. And so screening and assessment must become part of routine practice to not only decrease the birthing person's chances of being underdiagnosed and undertreated for perinatal anxiety, but to really ensure and to be actionable that we are providing quality healthcare services. And also, it is noted that telehealth, right, as we are in this new digital era of health technology, can be considered as a limitation for accessibility or capacity to effectively screen. However, it is better to screen than to not screen at all, as we know that the prevalence rate of anxiety and depression are higher during this perinatal period. And so utilizing such screening tools such as the Edinburgh Postnatal Depression Scale and the Patient Health Questionnaire 9, as well as following up with post-assessments, right? It is important that we go further than what these questions are on these screening scales. And so to follow up with open-ended questions that are specific and can facilitate clear prognosis of symptomology and experience. And so, as we have noted, the lack of mental health screening, continuity of care, and appropriate follow-up and assessment are all perceived as barriers to accessing adequate mental health services. And it is important that we, as healthcare providers, operate from a value-based and culturally responsive model that is person-centered. And so some interventions that we can utilize to address PMAD are mindful CBT and somatic therapy, which are evidence-based interventions that can decrease anxiety and reframe one's experience both cognitively and somatically. So mindful CBT, or cognitive behavioral therapy, is a practice that focuses on being attentive to one's thoughts, feelings, physical sensations, right? It really focuses us on the here and now without being judgmental, right? And also supports in developing a tolerance and threshold for stress. And so this practice facilitates more positive outcomes of stress reduction and increases one's ability to concentrate, to problem solve, and to increase that self-compassion, while also decreasing experiences of anxiety and depression. And so this approach really fuses the somatic and cognitive practices to be able to recenter one back into their body. And somatic therapy is a practice that focuses on the client's perceived body sensation, right? And so it's a modality that really is body-centered. And as we know, stress is a derivative of anxiety. It is stored within the body, and it can be challenging to solely address cognitively. And so somatic therapy allows individuals to identify the bodily sensations that may be occurring in their body and to mindfully attune themselves to be able to experience and identify that discomfort and tension in their body. And so through somatic experiencing, this approach allows us to seek to regulate the nervous system, right? And so really, again, attuning ourselves into the body so that we can increase capacity to identify and hold stress in healthier manners. So it increases the knowledge and awareness, and then again provides language so that we can address the bodily sensation that occurs in the nervous system to then approach how we then respond in a healthier manner that is best for the birthing person and ultimately baby.
In addition to the therapeutic approaches that Anika mentioned previously, it is equally important to use health education to decrease stress and increase health literacy as well. Patient-centered education has a great potential to improve the ability of patients and families to be partners in care and to improve health outcomes. Psychoeducation is a key component in overcoming stigma and decreasing barriers of treatment, thus, facilitating more successful interventions. Accessibility to resources that are digestible, easily comprehensible, and culturally competent are really key strategies of improving health education materials. Educational barriers, including literacy, language, and communication styles, are also extremely important to consider for equitable healthcare. In addition to some of the therapeutic approaches that Anika mentioned previously, it is also equally important to use health education to decrease stress and increase health literacy, right? So patient-centered education has a really great potential to improve the ability of patients and families to be partners in their healthcare, which is extremely important, and then to improve their health outcomes. So while psychoeducation is a key component in overcoming stigma and decreasing barriers of treatment and facilitating more successful interventions, increasing accessibility to resources that are digestible, easily comprehensible, and culturally competent are additional strategies to improving health. Educational barriers, including literacy, language, and communication style, are also really important to consider in order to achieve equitable healthcare.
As practitioners, Kaniya and I have witnessed several gaps within treatment and service methods. Often in BIPOC communities, they are defined as hard to reach. So in light of COVID-19, we have recognized the importance of community-based initiatives that are scalable in the digital age.
Here at Rooted, to fill this gap, we have implemented the People's Doula Project, which disrupts the persisting perinatal health inequities experienced by marginalized communities by increasing access to culturally responsive care. The People's Doula Project provides reproductive education, wellness exams, and mental health services delivered through a home visiting and telehealth doula model. That is evidence-based, in fact. We help our clients know their rights and how to navigate the healthcare system in a way that helps to address the bias and violations often faced by vulnerable communities. We really help to build trust and develop individualized care plans that consider our clients' unique identities and experiences. We educate our clients on the reproductive labor and delivery process to improve health literacy and empower them to make self-determined decisions. We advocate for our birthing community in real time during appointments with medical providers, and we strategically deliver mental health support to each birthing person through the duration of time in our care. The impact of the People's Doula Project has been incredible. We have seen reduced emergency room visits, lower perinatal anxiety, and increased health literacy to the reproductive process.
And during the COVID-19 pandemic, we've been able to make real impact by increasing accessibility to mental health and reproductive care by providing our services through telehealth. And our reach has expanded nationally, including New York, California, Oregon, Arkansas, Pennsylvania, and Virginia. In addition, we have partnered with local community-based organizations to organize our efforts on the ground to serve the hardest to reach populations. And by 2023, we aim to serve over 150 BIPOC birthing individuals with our services.
So we have talked about a lot during our session today, but we truly believe that preventative work is extremely imperative, especially for BIPOC birthing communities. So let's start with a recap. Today, we started with a working definition of perinatal anxiety and perinatal mental health. So really looking at the distressing thoughts that impact a birthing person's mental health, right? And how it is important to look at the risk factors that influence perinatal anxiety and perinatal mental health, which essentially are socioeconomic barriers, race, trauma, stress, right? We talk a lot about the hypertension, and also to think about some other things like the physical distressors, such as pelvic floor dysfunction.
Yes, and we've also talked about the importance of screening and assessment, and we cannot stress this enough, for this is true preventative work to be able to identify what our patients' needs are. So again, it can be anyone who has clinical access to a patient. As long as they are trained, they can be able to assess the patient and to identify if there are any mood disorders that may occur. Right, and we've also identified 2 evidence-based modalities that can support with easing anxiety within the perinatal experiences, that being mindful CBT or cognitive behavioral therapy, right, which really focuses on how to reframe the mental and cognitive experience of the individual experiencing anxiety, and the somatic regulation, which really centers in regulating the nervous system.
And we also introduced you to an evidence-based community model, the People's Doula Project, which is truly disrupting health inequities found in birth work. We utilize a home visiting model as well as telehealth to really ensure that this work is accessible, right? And we have seen the results of the People's Doula Project. It has a huge impact in lowering and decreasing health disparities across the board for BIPOC birthing communities. So now I imagine you are asking yourself, so what are the steps to take? Like, what can I do right here, right now to be a part of the prevention work and or intervene on behalf of birthing communities who are experiencing perinatal anxiety? So one tip we have for you is simply to inform yourself of the issues and disparities. Knowledge is key and power to really starting to disrupt a lot of the health inequities within the birth work. Also, take some time to think outside the box, right? Think outside the institutional education and training that many of us may have received, and really think about larger factors like racism, stigma, right? Think about what the individual may be experiencing during and after birth, such as pelvic floor dysfunction.
Assessment paired with continuity of care is really important when we're doing this work, right? And so what that looks like is going beyond the questions that are on the screening tools, asking open-ended questions so that our clients can have a felt sense that we truly care about their overall well-being, right? And so it's really important for the buy-in for folks to move past the stigmas that are in place specifically in BIPOC communities. And also coordinating with our care teams. We do not have to do this work alone. And so opening up and seeing who and how folks can support us to give the overall wellness of support to our clients and to our patients. And with that, it is important that we inquire with trust and intent. So what is the intention of us asking this question? And again, going back to the felt sense that our clients can be able to trust us so that we can build relationships to be able to support our clients in the best ways possible.
We definitely understand that individual capacity as a provider, as well as organizational capacity within large hospital systems, can be somewhat limited and maybe even bureaucratic. So, partner with a local community organization similar to Rooted. Thank you so much for your time and tuning in today to listen about how you can take the next steps in being a change agent in perinatal anxiety. Thank you so much for joining in on today's presentation, as this is a very important topic that affects many birthing communities of color.
Yes, and we hope that you take what you've learned in today's conversation and to apply it into your day-to-day practice.
So please scan the QR code below
and see how you can get involved in Rooted and the People's Doula Project.
And as always,
stay rooted.